Hey y'all, it is Rochelle, Hot Doc Shelly Smith, and today we're going to talk about sexually transmitted infections, formerly known as STDs, and the new treatment guidelines that were set by the CDC the beginning of this year. So the treatment guidelines have been changed and switched around, so I do want to go over that with you guys. So if you have sex, oral, anal, vaginal intercourse, and or genital touching, you can contract an STD, also known as a sexually transmitted infection, an STI. So regardless of your marital status or sexual orientation, you're vulnerable to STIs and STI symptoms. So thinking or hoping your partner doesn't have an STI is no protection. You need to know for sure. Condoms, when properly used, are highly effective for reducing transmission of some STDs, but no method is foolproof. And STI symptoms aren't always obvious. So if you think you have an STI symptom or have been exposed to an STI, please consult the healthcare provider. Also inform your partner or any partners that may need to be evaluated and treated as well. Some STIs are easy to treat and cure. Others require more complicated treatments to manage them. If untreated, STIs can definitely increase your risk for acquiring other STIs such as HIV. This happens because an STI can stimulate an immune response in the genital area and cause sores, either of which may raise the risk of HIV transmission. So some untreated STIs can also lead to infertility, organ damage, certain types of cancers, and death. So asymptomatic STIs. So many STIs have no symptoms, no signs. So we say that's asymptomatic. Even with no symptoms, however, you can pass the infection to your sexual partners. So it's important to use protection such as condoms during sex and visit your healthcare provider regularly for STI screening so you can identify and treat an infection before you pass it on. The first infection we're going to talk about is chlamydia. Chlamydia is a bacterial infection of the genital tract. It may be difficult to detect because early stage infections often cause few or no signs and symptoms when they do occur. Symptoms usually start 1 to 3 weeks after you've been exposed to chlamydia and may be mild and pass quickly. So some signs and symptoms include painful urination, lower abdominal pain, vaginal discharge in women, discharge from the penis in men, pain during sexual intercourse in women, bleeding between periods for women, and testicular pain in men. So the treatment regimen has changed for chlamydia. Now we're given doxycycline if the patient is not allergic, 100 milligrams twice a day for 7 days. As an alternative, we're doing azithromycin, 1 gram in a single dose of levofloxacin, 500 milligrams once a day for 7 days. The next infection is called Gynorail. So Gonorrhea is also a bacterial infection of the genital tract. The bacteria can also grow in your mouth, your throat, your eyes, and the anus. The first gonorrhea symptoms generally appear within 10 days after exposure. However, some people may be infected for months before signs and symptoms occur. Some signs and symptoms could be thick, cloudy, or bloody discharge from the penis or vagina, pain and burning sensation during urination, heavy menstrual bleeding or bleeding between periods, painful or swollen testicles in men, painful bowel movements, and anal itching. Gonorrhea can also be found at other sites of the body. So like the rectum, the signs and symptoms may be itching, pus-like discharge from the rectum, red spots of bright red blood on the tissue, and straining while having bowel movements. The eyes, it can cause eye pain, sensitivity to light, pus-like discharge from one or both eyes. And then the throat, you may have symptoms of a sore throat, swollen lymph nodes in the neck. For joints, you may have one or more joints that be infected by this bacteria, and it can cause warmth, red, swollen, and painful joints. So the treatment that we use for gonorrhea is Rocephin, 500 milligrams IM injection, meaning it goes into the muscle, single dose for patients less than 150 kilograms. If they're over 150 kilograms, it'll be 1 gram IM injection in the muscle. If chlamydia infection has not been excluded, We will also treat chlamydia along with gonorrhea with the dosage of doxycycline 100 milligrams oral twice a day for 7 days to be administered. An alternative, if the patient is allergic to Rocephin, we can do gentamicin, 240 milligrams IM injection in the muscle as a single dose, plus azithromycin, 2 grams oral in a single dose for the chlamydia portion of it. Or we can do sulfexamine, 800 milligrams orally as a single dose. So for trichomonas, trichomonas is a common STI caused by a microscopic one-celled parasite called Trichomonas vaginalis. So this organism spreads during sexual intercourse with someone who already has an infection. The organism usually infects the urinary tract in men, but often causes no symptoms. Trichomonas typically infects the vagina in women. When trichomonas causes symptoms, they may appear within 5 to 28 days of exposure and range from mild irritation to severe inflammation. So some signs and symptoms may include clear, white, green, or yellowish vaginal discharge, discharge from the penis, a strong vaginal odor, vaginal itching or irritation inside the penis, pain during intercourse, painful urination. So some treatments for trichomonas include metronidazole, 500 milligrams twice a day for 7 days in women, and metronidazole 2 grams as a single dose for men. And an alternative to metronidazole is the tinidazole 2 gram in a single dose for men and women. So what are some risk factors that increases your chances for these STIs? Being sexually active before the age of 25, having multiple sex partners, having a sex partner who has other sex partners, having a new sex partner, not using a condom consistently, and having a history of sexually transmitted infections. Some complications that can occur with STIs could include pelvic inflammatory disease. We also call this PID. That's when an infection of the uterus and fallopian tubes that causes pelvic pain and fever. Scarring can lead to infertility. So that's why it's very important to, if you think you have symptoms, to get screened so you can be treated in a timely manner so that this does not occur. Infection within the testicles for men, epididymiasis is the inflammation of the coil tube located beside each testicle. The infection can result in fever, scrotum pain, and swelling. So how can we prevent STIs? The surest way to prevent STIs is to abstain from sexual activity, right? So abstinence. Some things you can do: use condoms, a male latex condom or a female polyurethane condom during sexual contact. Condoms usually used properly during every sexual encounter reduce but does not eliminate the risk of infection. You want to limit your number of sex partners. Having multiple sex partners puts you at a higher risk for contracting STIs. You want to get regularly screened. So if you're sexually active, particularly if you have multiple partners, talk to your healthcare provider about how often you should be screened for STIs. You want to avoid douching because douching decreases the number of good bacteria in the vagina, which can increase your chances of getting an infection. So how do we diagnose these infections? So you can either do a urine test. The sample of urine will be analyzed in the laboratory for presence of STIs, or you can have a vaginal swab done in the clinic where the provider takes the swab to get some discharge from the cervix for a culture or an antigen testing for the STI. So if you've been treated for any of the above STIs, you should be retested in about 3 months to make sure the infection has cleared. Usually in my practice, I perform a test of cure in 6 weeks, okay? So these are the most common STIs, and the new treatments come from the CDC. So I do want you guys to have this information. One important point, when a female comes in and gets screened for an STI, if the patient is positive, definitely I will put a call out and say, hey, you were positive for whatever infection. This is a method. I will ask if they're allergic to any antibiotics at that time, just to make sure I'm not prescribing something that they will have a reaction to. We'll prescribe the treatment, and I just say, please inform any partners that you've been with in the last 60 days, okay? Please be a grown woman about this, and please inform the partner, okay? Even if y'all not together, you don't plan on being together with that partner, they need to know, because they also need to be treated, okay? If you're still going to be with that partner, you want to avoid intercourse for 7 days once both of you have been treated. So if your partner doesn't get treated from a month from now, it will be a month plus 7 days, because we don't want the infection to go back and forth between the two, okay? And at that point, it's time to have a discussion with the partner as well, because if they have other sexual partners, those partners needs to be treated, okay? So it's one of those things that you really want to protect yourself. Condom use, it's not 100%, but it definitely helps to reduce your chances of getting an STI, okay? And then making sure you follow up for the test of cure, so we can make sure this infection has been cured, okay? So that's very important, because we don't want you to end up with, like I said, PID, pelvic inflammatory disease, or infertility for that matter, okay? So I hope y'all enjoyed this session. It is new treatments, so please familiarize yourself with this just in case you happen to stumble upon it. Y'all have a good night. Peace.